unprecedented rate. Are there any concerns that long-term health impacts of a vaccine might not be detected? Are there any concerns about safety when the development process is at an accelerated pace?
Yeah, I think when we talk about accelerated vaccine development, what we hope is that we're talking about more efficient, faster, but still extremely safe, well-planned, well-managed. So what we're trying to do with many partners around the world, and there are many initiatives which are trying to accelerate the development of vaccine, but not cutting any steps, no shortcuts, no issues that can be shortcut in this. But there are things that have been done to speed up the process of that development, and it's been unprecedented, the cooperation, the collaboration, since many months ago, since the Director General hosted the meeting here of the research and development experts from all over the world in February, and subsequently in April brought partners together here to initiate the Access for COVID Tools initiative. Both have driven that process, but there are no shortcuts in science, and safety is a must. The trials that are underway now are safety trials, and efficacy trials will begin. Those first efficacy trials will need to be large, or as large as possible, for two reasons. One, so we can get an early signal of clinical efficacy, but also because if we move from vaccinating small numbers of people to vaccinating very large numbers of people too quickly, we may see effects that would not be detected in a small group. Rare side effects can be detected only when you have a large group of people tested. So we would like, and that's why we've been working with partners all around the world to ensure that the clinical trials that we carried out together are done on as large a scale as possible in order to be able to detect any rarer symptoms or side effects that may come from the vaccine. And it's an important question, and something that needs to be closely monitored. That is often why, even when vaccines are introduced for the first time, they're associated with what they call post-marketing surveillance. There's a much higher need to do surveillance when you introduce a new vaccine, even when it's approved, because there's always a chance of a very rare side effect. You need to be able to pick that up and manage it. So yes, there will have to be great care taken, and we have to balance the benefit of a vaccine that can save lives, and we have to manage the risks that are associated. Immunisation has proven over the last 50 to 70 years to be the single most effective health intervention and the single most effective life-saving intervention for children all over the world. And we hope, as we go through this process, that we will together find a safe, effective and affordable vaccine that will save lives in the coming years.
I would like to add to that. Safety for WHO is very central. And if you remember when we had the publication on hydroxychloroquine some weeks ago and the safety problems that was reported then, we temporarily suspended the Solidarity trial immediately because safety comes first. And with vaccines, the same thing. If a safety issue is raised, then we have to take action immediately. But before then, whatever safety precautions should be taken under the trial or the studies with regard to safety should be considered properly. That's one. And then the ACT accelerator that Mike said that was launched in April 24 was one, to accelerate the development, and second, to ensure equitable access to the vaccine, and for those, the vaccine to really reach everywhere, and those especially who needs it. So you have both components. But although it's not impossible to find a vaccine, it's very important to understand that it's going to be a very difficult journey. And we have to understand that. As you know, there is no known vaccine against any coronavirus so far. So if a vaccine is discovered, this will be the first vaccine for coronavirus. So you can imagine how difficult it could be when you are searching for something first. And the second issue with the vaccine is as we said earlier, the safety issue, which you said, and the safety issue should be assured. But more importantly, once you have the product, it should be accessible. I mean, those who need it should have it. But then, because of the issues that I raised, since this is going to be the first time and all the things I said, our focus should be in doing the basics. The basics meaning the comprehensive public health approach, something that's already at hand. I have already outlined some of the things before, and my colleagues have already said about them. The testing, the tracing, and the rest, and also what individuals can do. The keeping your distance, using masks when appropriate, and also cleaning your hands regularly, and all the precautions that you can take. We can actually keep away this virus by doing the basics, by understanding that this is everybody's business, and each and every individual should take care of herself and himself and his loved ones. He should care about the others too. When we do that, we can really suppress this virus. And that's why we're daily talking about that. We have to take more on what is at hand. We have to use what's at hand. Thank you.